Howdy, my name is Natalie Olson, and today I'm going to begin the presentation on bone and cartilage diseases for VIBS 289 with my group Merla Martinez, Nikki Wynn, Cody McCullough, Emily Osborne, and Luciana Navarez. The disease that I'm going to start with is craniosynostosis. That's a birth defect in which the spaces in a child's skull between the bony plates, they close early, resulting in abnormally shaped head. The cause is generally thought to be unknown. It's thought that it could be affected by genes, but usually there's no family history, so it's difficult to determine. So when it is inherited, it's normally accompanied by more severe other conditions such as blindness, Carpenter's or Pfeiffer syndrome. The symptoms of craniosynostosis include no fontanelle, which is the soft spot on a child's head. Raised or hard ridges on the skull. This is because they close early, so they start overlapping, building over each other. An unusual head shape, as I said before. This child on the right of the diagram would be one with craniosynostosis, and slow growth of the head that does not keep up with the rest of the development of the child's body. Diagnosis is normally done through measurements or feel of the skull, or it can just be seen outright, but CT scans and x-rays can be used to determine it where it's more iffy, and it can just be followed with a regular wellness check for the child, just to be sure that it is not going to be accompanied by something more serious. And these are questions on the first few topics regarding craniosynostosis.
Howdy, I'm Merla, and the primary treatment for craniosynostosis is surgery. There's two different types of surgery. One of them is traditional, and that is where the surgeon goes in and operates on the affected bones and reshapes the affected cranial bones. Endoscopic surgery is where the surgeon makes a small incision over the affected cranial bone and opens the suture to allow the brain to grow. This option is limited to patients. This option it's not for someone who would have to have their bones reshaped. The purpose of surgery is to relieve the pressure being exerted on the brain and to allow the brain to grow normally and improve the appearance of the child. Here's a picture of a child with cranio. This is someone who would probably have to go back in, who would have to go and do traditional surgery because they would probably have to get their frontal bone reshaped as well as possibly their occipital. Statistically, it is a rare disease affecting 1 in every 1,800 to 3,000 children. 3 out of the 4 cases are males. 80 to 95% of all cases are non-syndromic. There's over 150 syndromes which could cause syndromic cranio. After surgery, 1 in 15 children may have problems with the development of their skull as they grow older, and these are kids who would have to go back and have more surgery to correct the issue. The prognosis is really good. Patients require frequent checkups to make sure the skull, brain, and facial bones are all developing normally. You wouldn't want to have a child who just had surgery and for some reason the cranial bone is trying to go back together without and not leaving enough room for the brain to grow. Some forms of cranio may be very severe and could affect the function of the brain and development of the child. This is in a case where surgery didn't happen immediately and the brain was affected by with the pressure on it. Most of cranio children develop normally, and here are some questions over craniosynostosis.
Osteoporosis is a disease characterized by loss of bone mineral density. Fractures due to these weakened bones usually occur in the hip, wrist, or the spine. Osteoporosis occurs when formation of new bone cannot keep up with the breaking down of old bone. This usually occurs later in life since we reach our peak bone mass in our 20s, and then steadily lose bone mass after that. There are almost no symptoms early on, and sometimes osteoporosis is not diagnosed until after a bone fracture occurs. Some signs of this of osteoporosis could be pain and or loss of height or sudden severe back pain. The only way to diagnose osteoporosis is to test for bone density and see if an individual is at risk of bone fracture.
Hi, my name is Nikki Nguyen, and I'm going to be talking about the treatment, statistics, and prognosis of osteoporosis, a bone disease in which bones over time become fragile or brittle. Alright, so starting off, we're going to be doing treatment. And so depending on the bone density, there are options for medications that prevent more bone from breaking and slowing the loss of bone. So you see here there are pills available, and there's also the menopausal hormone replacement therapy, which can add estrogen and can aid in preventing bone fractures, because studies show that women who have had menopause also lack the correct estrogen levels to maintain bone density. Next off, there is a diet rich in calcium, which is essential for helping people with osteoporosis to fight against bone loss. So, you know the saying, milk makes your bones strong? It's true in this case. Also, weight exercises are good for bone strengthening and preventing bone loss. So you see this woman here, she seems to be stretching. Usually good for most cases, but to maintain strong bones, there must be weight training. Okay, so statistics. Osteoporosis occurs mainly in older women, with 1 in 3 women and 1 in 5 men over the age of 50 experiencing hip fractures. Nearly 75% of hip, arm, and spine fractures occur with people 65 years of age or older. Also, sunlight can increase the bone mass density of vitamin D deficient bone and can increase the prevention of bone fractures. So it's good to be out in the sunlight to go get vitamin D, which is a nutrient for helping bones absorb calcium. Alright, next is the majority of people who are at high risk who have had at least one osteoporotic fracture are neither identified or treated. Okay, next is prognosis. And although people with osteoporosis have complications from injury and a higher mortality rate, death does not occur often. Luckily, osteoporosis is associated with reduced mobility and an increased risk for complications, which can reduce the quality of life. So people who have osteoporosis do have to be more careful, walking, running around, lifting weights to make sure their bones can maintain their activity level. Okay, younger men and women can prevent osteoporosis by exercising with weights multiple times a week, as well as eat calcium-rich foods to prevent osteoporosis. So yeah, there is prevention in making sure you get enough vitamin D, some calcium, weight training, as previously mentioned. Osteoporosis is incurable, although there are treatments available to help decrease bone loss. People who are older and have had osteoporosis for longer are at a higher risk for injury and complication, as bone depletion reduces mobility. Okay, and finally we have the questions, and we also have sources. And I hope you enjoyed this video. Thank you very much.
Osteodystrophy. Osteodystrophy is a dystrophic growth of the bone. It is a defective bone development that is usually attributed with renal disease or disturbances in calcium and phosphorus metabolism. One form is renal osteodystrophy. Some causes. When calcium levels in the blood become too low, the parathyroid glands release a hormone called parathyroid hormone, which draws calcium from the bones, which weakens it. The kidneys remove excess phosphorus from the blood, so when they stop working, the phosphorus levels in the blood become too high, which results in the loss of calcium from the bones. And here's a picture of osteodystrophy in the knuckles. Sometimes the symptoms of osteodystrophy do not show, and in some cases they never show. However, some symptoms are bone and joint pain, bone fractures and bent bones, rickets, which is a condition that affects the bones due to vitamin D deficiency, delayed growth in bone and bone deformities in children, and weak and thin bones. To diagnose osteodystrophy, the doctors may take a sample of blood to measure levels of calcium, phosphorus, PTH, and calcitriol. A bone biopsy is also used to see how dense the bones are. And here are some questions to think about when you are reviewing osteodystrophy disease.
Osteodystrophy can best be treated and managed by a proper diet and supplements. Limiting the intake of milk, cheese, nuts, peanut butter, dark sodas, and beer can decrease the amount of phosphorus in the diet and help prevent bone diseases. Medications, such as calcium carbonate, also known as Tums, can aid in bonding phosphorus in the bowel, resulting in a decrease of the amount absorbed by the blood. If the overactive parathyroid glands are still not under control with the change in diet, medication, or dialysis treatments, they may need to be surgically removed as a last resort. There weren't many statistics on osteodystrophy, but it does show a very strong correlation with patients suffering from renal impairment and is seen in most adults after a few years of dialysis treatments. With a swift, accurate diagnosis and proper treatment, bone mineral density and structure can be supported, and the disease actually has a very good prognosis. Here are a couple questions to consider. And here's where I got my information from.